Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovi, a science-backed alternative to prescription medications. Ovi is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovi offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovi.com. That's ovii.com and start today.
Hi, listeners. I want to share a preface to this episode, as it includes what is still a controversial treatment for major depressive disorder, ketamine therapy. We interviewed Dr. Tashkandi and Dr. A's patient Anabel in the fall of 2024 to talk about best practices and outcomes for in-office, physician-assisted ketamine therapy to help with patients who have tried everything else available to relieve their suffering. Anabel, who you'll hear from in this episode, is a trauma survivor who was struck down so low by debilitating postpartum depression. Dr. A recommended Anabel try working with Dr. Tashkandi in his office. Anabel had no history of alcohol or drug abuse. She had none of the underlying conditions we go over in the episode that make ketamine a dangerous option. Anabel was able to experience relief with closely monitored in-office treatments and consistent cognitive therapy sessions. I say all of this because many of us first learned about ketamine from the tragic death of Matthew Perry, and we want to make sure you listen to Dr. Tashkandi's very clear usage indication for ketamine. It's not meant for recreational use. It's not a drug you can use to self-medicate on your own. We hope this episode is helpful and educational for those who want to learn more about the options available. As always, thank you for listening.
I'm so excited, and I know we say this every single time we have an episode.
Because we really are so excited every single time.
But this is so near and dear to my heart. I've always wanted to do a ketamine podcast, and today I have one of my dearest patients, Anabel, and Dr. Peyman Tashkandi, who's a psychiatrist for pediatrics, adult psychiatry, and I've referred my patients for years to him. And these two incredible people are going to educate us on ketamine. So welcome to SheMD. We're so excited to have you here.
Well, can I just jump in? Because you suffered from severe postpartum. You'd had a lot of mental, anxiety, depression before that. And I don't think we talk about postpartum enough and really how debilitating it can be. And you say that ketamine really did transform your life. So can we just really start off by just telling us all about your background and how you got into ketamine, and then I have specific questions for you.
Sure. Thank you so much for having me. First of all, I have to say that Dr. A has been the reason that I'm here today, because she's the person who pushes me to actually strive to be my best. So thank you. I'm a psychiatrist. My name is Peyman Tashkandi. I'm a double board certified psychiatrist. I'm certified in general adult psychiatry and child and adolescent psychiatry. Over the past 2 years, I had the chance of directing a ketamine clinic, and I was able to work with a lot of patients and see that transformation firsthand. Initially, when I got into the work with ketamine, it was an opportunity that came up, and I took that opportunity through actually Dr. Aliabadi. And, initially I did not expect the results that I was seeing from patients, because you read about it, you see it, you hear about it within the academic context, but seeing an actual transformation in patients' lives with your own eyes is something very different. I'm a psychiatrist. I've worked with mental health patients and psychiatric medications for a long time at this time. And I have not seen the level of improvement that I have seen with ketamine infusion therapy. And we can talk about, how that is and what are the reasons behind it that this medication is more of a life-transforming medication.
So can we back up and explain to everyone listening, like walk us through what a ketamine treatment looks like and
Sure.
what is it doing to your brain and why is it so transformative?
Sure. So ketamine is a dissociative anesthetic medication. So let's look at the history. In 1960, a scientist by the name of Calvin Stephen developed ketamine to replace another anesthetic medication that was called PCP. PCP had a lot of side effects, therefore ketamine was discovered or created in that manner. And in 1970s, FDA approved it for anesthetic purposes. So if you're doing surgery, if you're having a procedure, if you go to the ER and you have a dislocated shoulder, oftentimes you're going to receive ketamine. Now, one of the reasons that it's one of those medications that is used is because of the fact that it's not too daunting on our respiratory system. Surprisingly, this was the medication that they used in Vietnam War a lot on the battlefield because of the fact that it didn't have complications. Therefore, in 1970s, it got the FDA approval, which it still has for anesthetic purposes. In 1980s, there was the war on drugs. So it kind of put a lot of the psychedelic medications in the back burner. And by that time, it became a recreational drug on the street. So fast forward in year 2000, Dr. Peyman at Yale University started doing a study on patients who have had treatment-resistant depression. So he brought some patients who have not responded to other medications and gave them ketamine. And he saw a profound change in their mood. It was rapid acting. It was working very quickly. And it was taking care of their years-long depressive symptoms. Since the 1980s, most scientists and doctors would see these antidepressing effects of ketamine. However, the effects of these antidepressing effects of the medication was actually short-lived. So 2000 onward, they started having series of infusions, meaning that you have one infusion, then you'll have another one a few days after, and then another one. And once you increase the time between the infusions and once you had numerous infusions, there was a stacking effect. And at that time, patients started having antidepressant effects of the medication lasting for them way longer. You asked about how does this medication work. I think it's very good for us to kind of get into the
science behind it.
So let's talk about depression and theories behind depression. So depression is depressed mood or anhedonia, lack of interest for at least 2 weeks with 4 other symptoms. Those could be lack of sleep or increased sleep, lack of interest in things that you like to do, which we call anhedonia, decrease or increase in appetite, change in sleep, change in attention and concentration, suicidal ideation, and hopelessness, helplessness, worthlessness, these feelings that come on board. Basically, we have 3 neurotransmitters in the brain called dopamine, serotonin, and norepinephrine, and fluctuations in these neurotransmitters can cause depression. So that's one theory. Another theory is the theory of hypothalamic pituitary axis, that there's a dysfunction, and that's a hormonal theory. So hypothalamus in the brain, pituitary in the brain, and adrenals over the kidneys, and any changes in that can cause depression, specifically long-term stress on an individual. So that goes into individuals who have significant chronic stressors as a child, for example, neglect, abuse, torture, things of that nature, sexual abuse as a child or older. Another theory behind it is neuroplasticity theory, meaning that the neurons in the brain, we used to think that neurons in the brain actually don't change after the age of 25. We don't build new neurons, except areas that you always have to change and build new connections, which is your memory, learning. Let's say you're learning how to drive. Nowadays, you've been driving for a few years. You don't really think about how to put your foot on the brake or gas. But initially, when you were learning, you had to put that to memory. So that's neuroplasticity. Your neurons are trying to learn something new. So the theory behind neuroplasticity is that this particle called BDNF, which is brain-derived neurotrophic factor, in the brain is actually low in patients who have depression, which surprisingly and interestingly enough, ketamine increases that in patients. And that you need that protein for adaptation, growth, and creating new connections in the brain. So this was the third one, right? The fourth theory is that it's an inflammation theory. Ketamine is an anti-inflammatory drug that can decrease inflammation in the brain. Now, think about it this way. When you have patients, Dr. A, that receive steroids, they might feel euphoric for a few days. Because of the anti-inflammatory effect of the steroids, patients might feel euphoric. So that's the fourth theory behind depression. And so the fifth theory is basically going to talk about the effects of the environment on an individual that really plays a significant role on development of depression. There are certain genetic factors that you cannot change. I cannot change my height. I cannot change my eye color, biologically speaking. However, there are parts of the genes that if you have predispositions to certain genetic variants, you're at risk for certain things. So when you see an individual, you're looking at that person from a biological lens, from a psychological lens, and a social lens. Biological means genetics, means whatever you were bestowed on from your parents, and epigenetics, meaning that how the environment affected you growing up. Psychology is your schemas. What do you believe? What do you see? What is your mental pattern when you have an adversity in life? And number three is social. The social component is basically your culture, religion, spirituality, environment you grew up. So I'm going to bring all of these together now. So you asked about ketamine and how does ketamine work? There are few things that ketamine does. One, it increases glutamate, which is an excitatory neurotransmitter in the brain. How does it do that? It blocks NMDA receptors. No other antidepressant does that. When you block the NMDA receptor, you increase activity of glutamate within the synaptic cleft, and that increases the activity of another receptor called AMPA. And when that receptor activates more, you have created an environment that neuroplasticity can happen. Neuroplasticity means that neurons can form better connections together. And this is the reason that ketamine or psychedelics in general pop the patient out of that feeling of stuckness.
I have a question. I know ketamine works for depression, but does it also help patients who are anxious?
Yes, it does. So in the brain, depression and anxiety are very much similar in terms of the areas that is affected. There's some areas that are distinct. So it is very hard for you to find a patient that has depression and doesn't have anxiety.
As I'm listening to you, you're saying, acute depression. So this isn't for someone that is, I feel a little anxious, I feel a little depressed, or could that person also benefit from it?
We have to talk about clinical depression, clinical anxiety, and then healthy level of, anxiety, and also
that's normal.
That is normal. And
okay.
There's a fine line between them. So this is how I usually explain this to my patients. It's normal for us to be anxious. We have to be anxious. Actually, if you're not anxious, you won't be able to propel forward in life. Your anxiety probably caused you to be successful in life. If you had an exam tomorrow and you didn't study for it, you would fail. But your anxiety tells you, we call that eustress. That's good stress to have. Now, if anxiety gets to a point that it's getting in the way of your functioning. So these are patients that come to me and say, I cannot start my day because I'm always thinking something horrible is going to happen. I have this feeling of doom and gloom all the time. I have my heart racing 150 beats per minute all the time. These are not normal because then you cannot really do your life. So
Anabel, you suffered from postpartum, and I want you to kind of tell us about your story. When you were growing up, did you have anxiety and depression?
Yes. I battled with anxiety and depression pretty much my whole life.
When's the first time you remember having anxiety and depression?
As a teenager. It was pretty severe, and I was very exhausted as a teenager, and very nervous. And I was put on medications on and off, SSRIs mostly. And then I sort of just powered through life. Like I went to college and really battled with depression, and I just sort of accepted that I had one of those brains. And I knew it wasn't normal, but no one really ever explained to me what was going on. And it wasn't until I had my son that, the postpartum depression, it was extremely intense. Everything that I had felt my whole life was turned way up. I had night sweats, paranoid thoughts. I had these very violent flashes of bad things happening to my son and to my family. I felt really hopeless and worthless and full of shame. And I could barely even leave my house. And traditional doctors will say, go for a walk, do some meditation, do some breathing exercises. I'm like, I can't even get out of bed. Like, none of these options are available to me. So what can I do?
With kids in school who are always bringing home whatever cold they pick up from classmates, I'm thankful for supplements that support a healthy immune system. Symbiotica's liposomal vitamin C makes it so easy to stay healthy and feel good. This formula plays a key role in immune system function. It also promotes collagen production in your skin, giving you a bright, dewy glow. It contains one of the world's most beautifying vitamins, biotin, to give you that radiant look. Not only do you get support with all these wellness aspects, it tastes delicious. Symbiotica's liposomal vitamin C comes in these convenient little liquid pouches, perfect for when you're on the go or traveling. I feel assured knowing Symbiotica's formulas are clean, intentionally sourced, and only have ingredients I need to feel healthy. I love the taste of their vanilla citrus vitamin C. Their convenient monthly subscription service helps you never run out of your health-boosting essentials. High-quality, holistic wellness right at your fingertips. Be present and feel your best for life's most memorable moments. Go to Symbiotica.com/CMD for 20% off your order, plus free shipping today. That's spelled Symbiotica.com/CMD for 20% off your order.
And I remember I went to Dr. Aliabadi's office for my follow-up.
And how old was the baby at this point?
He was about maybe 4 months, 3 or 4 months. And I went into your office and I was just holding back tears. Like I couldn't even be in there. Lights were very bright. And you said to me, are you okay? I said, no, I'm not okay at all. And I started crying. And you said, well, we kind of knew this was coming because you had depression throughout your life. So, you can either go back on SSRIs or there's this treatment that you could try, ketamine infusions. And I know SSRIs very well. And I didn't have a great experience with them. They never really helped me. They could kind of get me out of a really dark slump. But they've sort of flattened me out. I still felt like I wasn't really experiencing my life to the fullest. And I said, sure, I'll try the infusions. Why not? I trust Dr. Aliabadi wholeheartedly. Actually, we joke in our house that she's more like a fairy godmother than a doctor. Like, obviously you delivered the love of my life into the world, but also you saved me and my family. And I wish that more women had doctors like you and access to this information. And what ketamine did is it brought my brain to a place where I could do the things that I needed to feel good.
And you could go for a walk, and that would help that situation.
I could go for a walk, listen to all the podcasts, the breath work, the workouts, all the things that I needed to then really get into a super healthy place. Ketamine got my brain into a space where I could do that.
I mean, you hear that with postpartum depression. I mean, it's really like what you're describing, I've heard time and time again. And you really are, when you're in that place, you feel hopeless and you can understand all of these other things that happen. So can you walk us through, so you're in her office, she tells you that she thinks that this is what you should do. You go right away and then walk us through what that looks like. And when Thais describes it to me, she's like, no, this is like, there's monitors, it's a medical situation. Yes. So kind of talk about that. So
I visited the ketamine clinic that Dr. Tashkandi is supervising, and I had no idea what to expect. They have these rooms it's very peaceful actually in there, but it is a very legitimate clinical setting. And I went into this room and sat in a big comfy chair, and I was hooked up to an IV. I was given an eye mask and some headphones and walked through the process of how I would feel. Basically had this infusion for 50 minutes and, sort of went into another dimension. I'm also a spiritual person, and I just was laying there like, oh my God, it was a very intense, profound experience. And I felt a little bit better after the first infusion. And then the second infusion okay, I see what's happening here.
How
And
long
then-
between the first and the second infusion?
So I did 6 infusions over 2 weeks. So 3 and 3. And
Is that the normal? Is that,
Yes.
Okay.
It's actually important, I think, to stack it. I'm not a ketamine specialist, but I've referred hundreds of patients over the years. And one thing I've noticed is if you stack them, 3 the first week, maybe 2 the second week, and 1 the third, or 3 and 3, you see better results than doing one and letting it be. Sometimes they actually do boosters too after you finish your 6 sessions. But go ahead.
yeah, I actually just did my boosters because I flew here. Just
Good.
did my boosters this week. I do them like every 8 to 9 months or so. But yes, after the 4th session, I was like, oh, this is the real deal. Like I feel significantly better. And then by the end of my infusions, you know, my son's dad says it's like miraculous. I went from this, for lack of a better word, disheveled, lost, sad new mom that was just like panicking and freaking out, to this like powerful, excited mom. And I started working out and calling my friends and playing with my son. And, you know, I mean, the rest is history because it changed my life. It didn't only save me from postpartum depression, it saved me from a lifelong battle with depression. So I have since become an extremely high functioning person. I don't wake up with depression. I don't have a depressed brain. I have hard days. And, you know, my anxiety will creep in sometimes because I'm building a startup and I'm doing a lot of really scary things, but
That's
is
appropriate.
Yes.
Of
That's
course.
me pushing myself. I feel the fear and I push myself and I feel powerful.
So can we talk about a couple of things?
Yes.
Did you get off of all of your medications?
Yes, I'm not on any medication.
That's amazing.
Did you have childhood trauma?
Yes, very much so. Yes. And actually found a therapist through the clinic and did some EMDR and have done routine sessions with her, actually with ketamine lozenges and EMDR reprocessing. And I had a very intense shame network with a lot of trauma and a lot of pain, and it disconnected me from the world around me. And now I feel very connected.
Don't you get goosebumps?
Yes,
listening
this is
to her?
amazing. But my question is the treatment you go in, you do these, do you do therapy in between them? Like, is that part of it? Or can it just be like, you go, you get the infusions, you don't have to have therapy? Like, can you talk about that?
That's what I tell all my patients. If you are in therapy after you had an infusion, it is best for you to partake in therapy within 72 hours. If you do not do therapy, you're still going to benefit from the treatment. However, I think putting things into perspective with the help of someone who can integrate your experience is going to be immense. At the clinic, the nurses try to do that, post-infusion. You're not always in the right headspace for integration right after the infusion. But I would say the next day, the day after that, it's going to be a very good time for you to do so. Let's talk about what generally is the experience for most patients. It is possible for patients to have bad experiences, it's true. However, majority of patients actually have good experiences. The first one is the hardest one to
'Cause
do
you're
because
scared.
it's a novel experience. You've not done this before. It's scary. And your mind is very powerful. It will take you places. Your state of mind before going into it is very important as well. I would say majority of patients actually have a blissful experience. Again, but it's very
It
different.
can be different. So don't feel bad if you don't have that.
Yeah, it's also very important for the patient to eat and drink afterwards, especially like a lot of fluids and electrolytes. And, ketamine has a short half-life. The half-life is between 3 to 4 hours. So if someone has side effects, usually side effects, should go away very quickly. By next day, you should be functional. There are individuals that their bodies are naive to medication. They probably are slow metabolizers of the medication. So it lingers a little bit longer. What we tell patients is that after the infusion, don't make big decisions that day. By next day, you should be okay.
Now let's talk about the negative. I think we would be remiss to not to discuss, the Matthew Perry of it all.
Sure.
There are some bad actors out there that are just, using this new, because now you're starting to hear about it. When you have a patient that is addicted to that, like, how do you deal with addiction? Because because it can become people wanting to take, you know what I mean? So you know what I'm asking you.
Yes, of course. Let me tell you who is not a good candidate.
Great.
So psychiatrically speaking, someone who has schizophrenia or schizoaffective disorder, meaning that they have had psychosis, they're not a good candidate because it can induce psychosis.
Okay.
If someone is in an active state of bipolar disorder, meaning actively manic or actively hypomanic, in that state, it's not a good treatment. However, bipolar depression, a very good and effective treatment. If someone has, medically speaking, uncontrolled hypertension, meaning that they're not, their blood pressure is 170 over 110 and they don't take any medications, not a good, candidate at that time. Once their blood pressure is under control, yes. If someone has uncontrolled thyroid issues, that they can go into a thyroid crisis, they're not a good candidate in that time. In addiction psychiatry, oftentimes we use medications that are addictive themselves to treat addiction. So opioids, we use methadone, we use buprenorphine or Suboxone that are all addictive medications. And then there's this other idea, which is the ideal idea is abstinence. If someone is addicted to a substance, the idea is for you hopefully not to ever do it, right? Now, can ketamine form habit? Yes, it's a controlled substance, but it's relative.
But you're not saying, hey, replace all those with ketamine.
No, I'm not saying that. Ketamine is such an inward experience. If you can control how you are receiving the medication, you're more likely to be able to control abuse compared to these other medications or substances that are out there. Okay. Now, if someone has a history of addiction, specifically, let's talk about alcohol. If you have a patient who is an alcoholic, but they're alcoholic because they have such high functioning anxiety that they take the alcohol to numb the anxiety. If you take care of the anxiety, are they going to go back to alcohol? Less likely. If you have someone addicted to a substance that they have gone in and out of rehab, they've done so many years of treatment and nothing has worked for them, the risk of relapse is going to be higher for that person, right? So safety is number one. That's why I don't like sending patients home with any form of ketamine that have history of substance abuse. And again, everyone is case dependent, every case.
You know what I want to talk about? One thing that always surprises me, Peyman, is for years now, I've seen, because I've done so many referrals for ketamine, and patients like Anabel come back to my office and they talk about their experience. Why is it that more psychiatrists don't talk about it? Someone like Anabel, who had been in therapy, who'd been on medication for many years, she had never heard of it. 99% of my patients who I offer ketamine to, they've never heard of it. And when I call their psychiatrist to get permission, I call them like, your patient is literally in my office on the floor crying. She's dysfunctional. She's curled up on the floor. What should I do with her? And he told me, he's like, well, tell her to come see me on Monday. What do you mean come see me on Monday? She's on the floor, crying. She can't even get up. And what I did, I took her keys. I basically put her in a car and I sent her to the ketamine clinic. And this woman, if you see her now, just like Anabel, like nothing happened. But this doctor was so resistant because I kept saying, why can I send your patient to ketamine? He's like, it's not going to work. Why so much resistance?
It's a very good question. I think, part of that answer is our guidelines are slow to develop and change with anything. Also, authorities in the field of psychiatry, they're probably waiting for more and more results to come out for them to be able to put their stamp of approval. There's a lot of politics involved as well. So think about 45 million Americans are receiving prescription for antidepressant medication. And 21 million people in America have major depressive disorder. That's roughly 8.4% of the population. And in terms of suicide, 50,000 Americans took their life last year. Think about it.
That's what I'm talking about. Like I've seen.
Well, we're having a mental health crisis in our
But
country.
I've sent patients with suicidal ideations to your clinic, and they come back 3 weeks later like nothing happened. I mean, the change is shocking.
Can you do ketamine therapy if you are on anti-anxiety medicine or SSO, or do you have to get off of it first before you do it?
There are a few number of medications that we advise patients to not take it at the time that they're doing the infusions. I think another part of this is that a lot of psychiatrists are not trained. If I'm not trained in a modality,
right?
I think part of that is, even when I was in training, which was not that long ago, ketamine was not something that was thought to me. I learned ketamine or TMS through the work that I'm doing. If you're using this treatment, with any treatment, with integrity, in a safe environment, with taking the whole person into consideration, it can work.
You've talked about the positive things that happen in the brain. Are there negative things that happen in the brain by using ketamine treatments?
So we don't have long-term data showing us that, okay, if someone does 20 years of infusions, what's going to happen? Most of the data they have are going to be based on individuals who have used ketamine for many, many years. These individuals have done tremendous amount of these medications or this substance. And most of the negative effect that you see in those substance abusers is this thing called ketamine cystitis, which is a bladder that gets inflamed. And I've not seen it with patients that are getting treated via infusions. And part of the reason for that is that you're not getting that exuberant amount of substance over a very, very long time. And we need to really wait and see what studies show for long-term effects on the brain. The neuroplasticity that happens in the brain, it's a positive thing, right? I tell my patients all the time, you're in the driving seat. You will dictate your care. I'm your coach. I will hold your hand. Sometimes it's my job to nudge you in the right direction. You probably nudge your patient a lot in the right direction. I know you don't.
You're nicer than I am.
But at the same time, I want you to understand that if a patient who is super depressed coming to me, they don't even have the energy to even shower or brush their teeth. Do you really think they have the mental capacity to make their decision, long-term decisions for themselves? Probably no.
Let me tell you about a product I love, Lumi deodorant. Unlike most deodorants designed for only the underarms, Lumi is safe for the entire body, including private areas, feet, and underboobs. I love taking a hot yoga class. And most of the time, my sweat evaporates quickly and usually doesn't smell bad. But when it comes to stress sweat, I need Lumi's help. Lumi comes in a range of fresh, bright scents, plus an unscented option, which is my go-to. Lumi Starter Pack is perfect for new customers. It comes with a solid stick deodorant, cream tube deodorant, 2 free products of your choice like mini body wash and deodorant wipes, and free shipping. As a special offer to our listeners, new customers get 15% off all Lumi products when you use code SHEMD at checkout. If you combine the 15% off with the already discounted starter pack, that equals over 40% off their starter pack. Go to lumideodorant.com and use code SHEMD for 15% off your first purchase. That's code SHEMD at LUMEDEODORANT.com. Smell fresher, stay drier, and boost your confidence from head to toe with Lumi.
Do you have patients that come and they're just like, you know what, I've been on anti-anxiety medicine my whole life, or I've been on an SR, I don't want to do that. I want to try
Yes.
ketamine. Does that?
Yes, we've done that before, and we do it. You know, if a patient of mine says, I don't want to use antidepressants because I don't want to be on a medication long term, and I know that there are side effects associated with antidepressants, that's great. We can try this, modality of treatment. And
So right now, currently, ketamine is not covered by insurance.
so there's one form of it that is covered by insurance. That's S-ketamine, which is a nasal spray. Now, it's been out since 2019.
And it's used for what?
For FDA indicated for treatment of major depressive disorder as an adjunct to an antidepressant. So
Okay.
that means that you have to be on an antidepressant, and then you can start to
And you have to be
Ask for
under a doctor's care.
Yes, of course. You
Yes.
have to receive it only in the clinic.
Okay.
You cannot take it home.
Okay.
I'm very much against sending patients home with nasal
I agree.
spray. I do not recommend it because this is the form that can get abused.
Right. Okay.
And also, it's not, you don't really know how much they're getting because it's just very messy.
And so how do our listeners or viewers or anybody that's interested in this find the right kind of clinic, the right kind of doctor? What are the things they need to look for?
I think what they really need to look for is, first of all, they need to find a clinic, in my opinion, that they do have mental health services or professionals involved. Having a psychiatrist, psychiatric nurse practitioner, or a psychologist is going to be imperative for you to get a good care. Number two is you have to have a very good coordinated relationship between that clinic and your mental health provider if you have your own in the community, and starting the discussion with the with your psychiatrist or primary care doctor. And one of the most important things is that if the clinic has a good reputation, they're doing safe work, and it's important for them to treat you as a whole individual rather than another person that they can actually make, money from.
Okay, great. So I want to ask the two of you guys, for someone listening that either A, can't afford to go see you guys, B, doesn't live in Los Angeles, where can they, and if they're in Alabama, Tennessee, Florida, how can they find someone to do this with?
Again, we're here, we're at GMD because we want to empower you at home to get the education, the knowledge you want. I learned so much from you today about ketamine and depression and different forms of depression, which I know I want to have you sit here and talk more. Maybe we'll do another session about this. But patients can start with their own psychiatrist. Ask them, what about ketamine? And if they say no, ask them why no. And that's exactly what I do when I call these psychiatrists who decline it. And then the other thing is just look clinics around you.
Let me say something that I think is very important. One of the reasons that patients with mental illness or psychiatric disorders, they don't seek help, one of the main reasons is that you attribute that issue to who you are as part of your identity. If you have a patient who has, let's say, high blood pressure, they don't usually tell you, I am hypertensive. But if someone has depression, they say, I'm depressed, I am anxious, I'm bipolar, I'm schizophrenic. So they attribute that to who they are. And that's where the stigma comes from.
Well, we have a mental health crisis in our country, but especially with children right now.
Yes.
We're hearing it, like a child in high school has committed suicide, all of these, and to get to this place. How do you treat children? Children can't do ketamine, I imagine, or can they? Is this, if you've got a child who is literally, you've gotten to the end and like, is that something that you've done with children?
So children and adolescents, it's a very much case by case basis. And there's a lot that goes into that. So if you are considering treating a child or an adolescent, they really need to be seen by a child psychiatrist and usually have tried other modalities before trying any other modalities that include medication or ketamine infusion. And yes, but the short answer is yes, there are adolescents that I have treated that this was the only thing that worked for them.
Do you need permission from their parents to
Yes.
treat them? Yes.
Any form of treatment for any child or adolescent, you need permission from both parents in mental health.
Both parents.
Yes. So if mom says no and dad says yes, you can't really go forward.
And have you noticed treating men and women, is it different?
Yes.
And how is it different?
Women tend to have internalizing symptoms, meaning that they internalize everything and it turns into anxiety or depression. And men have externalizing symptoms. They become aggressive, they become violent. This doesn't mean that everybody's like
Right.
that, but generally that is the trend. Because of the complexity of hormones for women, there's a lot of mental health conditions or psychiatric disorders that are female specific, in a sense that PMDD, PMS,
Right.
postpartum
Menopause.
depression, menopause.
No,
Yes.
but that's why
That
I
is
asked
true.
earlier. Like,
Poor
are you
women.
seeing a lot
I
of
know.
women, perimenopause and menopause, who are coming to you for this that were like, I've never suffered from this? And is it the hormones? We blame everything on hormones.
Well,
but-
hormones play a huge role. Estrogen is a happy hormone. It makes us happy. So, when you deliver and your hormones just plummet by pulling that placenta out, postpartum is like an exaggerated PMS. So if you've had depression, if you've had anxiety, if you've had extreme PMS or PMDD in your life, you're more likely to have these issues postpartum. And I just want to make a note here, because we're not talking about pregnancy, but it's important for patients to know that there are drugs that are completely safe to take during pregnancy. So if you're on Lexapro, for example, if you're on Zoloft, if you're on Prozac, you do not need to stop them during pregnancy. Now, if your symptoms are mild and you feel like you can do it, great, come off of it. But if you come off of it and then you start feeling those feelings, you can absolutely take these medications, especially to protect yourself during pregnancy, but mostly postpartum.
And I don't want to leave without talking about what you said now you're a superwoman. You just created your
A
business,
startup.
which hasn't launched yet.
Yes.
Can you tell us just a little bit about that before?
Yes. One of the things that I did when I healed my brain from ketamine was I started to focus on my gut health. And I learned that almost all the chronic diseases of the chronic disease epidemic are linked to microbiome injury. And it blew my mind. And I started fermenting my own foods and taking a variety of probiotics. And I learned that gut diversity is the strongest indicator of a resilient gut microbiome. And so that is what our product is addressing. I'm working with a number of scientists and doctors from Johns Hopkins, accredited by NASA, Oxford. I feel really blessed, and I'm really excited to get this product out and to share it with you guys. And I just can't thank you guys enough. I mean, the work that you're doing is so important. I'm someone who felt hopeless my whole life, and you saved me, Dr. Aliabadi. So thank you.
I love you.
I think that, we live in a world where we have all these polished portrayals of women, and you guys are kind of taking the curtain back and really asking real questions and sharing real stories. And I think that that's what women desperately need. We don't want more, BS, for lack of a better word. We want real stories. And women are going through postpartum or trying to be moms, and we're alone and we feel alone. And it's not easy. It's ugly. Sometimes it's beautiful, but it's not perfect. And so thank you.
Oh,
Thank
that's
you.
what we do, what we do. Thank you,
Yeah.
Annabelle.
You are exactly why we do what we do.
Yeah. I
Thank
love
you guys
too.
both for being here.
Thanks.
To have her do it a pickup. So thank you for being here.
Yeah.
Annabelle, I love you. Thank you for coming, for
too.
sharing
Thank
your
you.
story. This is so personal. So I just want you to know that we appreciate you talking about this
Thank
publicly.
you. Thank you for having me. Yeah.
Thank you for having me.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health.
Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.